Good evening, everyone, and thank you for tuning in to Hotline 21 on CAN TV. This is a live call-in show, so feel free to dial us up at any time. The number's at the bottom of your screen, area code 312-738-1060. My name is Jenny Brandhorst, and I'm filling in for Susan Reyna Guerrero. I'm here with Kelli Hanlon. We are from Beacon Therapeutic Diagnostic and Treatment Center. We are located on the south side. We also have 3 other locations that I'm going to put up for you right now. Our business office is at 1912 West 103rd Street. We also have 2 schools, therapeutic day schools, at Longwood and also one at Calumet Park. And we also have homeless outreach services, which we'll be focusing on this evening with Kelli. And Beacon Therapeutic was founded in 1968. So we have been empowering the lives of many different people and families for 43 plus years, and we're happy to be of service. And I'm delighted tonight to have Kelli Hanlon with me. Kelli is a licensed clinical social worker, and she is one of our child parent therapists in our FACT program, which FACT means the Family Assertive Community Treatment Program. And FACT was launched in October of 2008, right, Kelli? Mm-hmm. And is going through this year, June 2011. We're hoping to keep it going and keep it sustained. So Kelli's going to talk to us about FACT. And one more piece of information I want to put up before we dive in with Kelli here is that Beacon's other programs that we have are the Little Big Intensive Outpatient Program, our outpatient clinic, FACT, our Family Assertive Community Treatment Program, Early Head Start, Shelter Outreach Services, CHIPRA, and our therapeutic day schools, as well as an autism initiative. And without further ado, let's get to know Kelli Hanlon. Kelli, you've been with Beacon since 2009. Tell us a little bit about what brought you to Beacon and what your role is at FACT.
Okay, well, like you said, Jenny, I'm a LCSW licensed clinical social worker, and I also have a master's in clinical social work and a certificate in infant mental health. And so before I came to Beacon, I had actually been hoping to find a job where I could specialize working with young mothers or young families with young children 5 and under, which is what infant mental health specializes in. So when I learned about the FACT program, I was really excited because I've always had a strong interest in homelessness and that parent-child relationship, and I felt like FACT was the perfect fit.
Now, are you from Chicago? Or
I'm actually originally from Detroit. I just moved to Chicago 4 years ago, and prior to coming here at Beacon, I had worked in child welfare system. I had worked in adoptions and worked in a residential treatment center for teenagers and school-aged children, as well as a runaway shelter for teenagers as well.
So you were very well prepared for your role with the FACT initiative. And let's, for our viewers, talk a little bit about FACT. It stands for Family Assertive Community Treatment. But what does that break down to? What does the program entail, Kelli?
Well, the FACT program is, we specialize in working with young mothers, 18 to 25 years old, young single mothers.
Keep talking. I'm going to put some information up.
Okay. And all of our mothers have to have at least one child, 5 or under. Mm-hmm. Our families are either homeless or at risk of being homeless, which means that they might be doubled up, meaning that they're either living with bouncing from cousins, family members, friends. Mm-hmm. A lot of our families the moms were previously wards of the state, where they recently emancipated at the age of 21 and then became homeless because they had nowhere to go when DCFS or the foster care agency stopped caring for them or financially funding them. We also, to be a part of the FACT program, you have to have a mental health diagnosis. Typically it's depression, bipolar disorder, schizophrenia, post-traumatic stress disorder, anxiety disorder. And then in addition to that, we are looking for 1 or 2 or even more risk factors. So for example, domestic violence, substance abuse, gang or criminal involvement, DCFS involvement, so whether mom was a DCFS ward herself, meaning
DCFS meaning
Department of Child and Family Services, meaning that mom was removed from her parents as a child and then either was raised in foster care or when she gets to be a teenager, that 18 to 20 range, living in a group home or basically being overseen by DCFS. Or we have moms that their children are actually in foster care. So mom doesn't have custody of the kids. Mom, has the kids in foster care. And then finally, an additional risk factor we'll look at is if the child has any emotional concerns, any developmental concerns, behavior concerns, or like medical issues that they need assistance with.
So a lot of the FACT participants are being referred, obviously, through Department of Child and Family Services. What are some of the other referral sources?
We get really referrals from everywhere. We have homeless shelters throughout the city will refer to our program. We also get we've had referrals from hospitals. We've had referrals from if maybe mom is in her own community counseling, or the children are in early intervention or some special program for kids. And now that we've been up and running now for 2.5, almost 3 years, we get a lot of referrals that are from participants that we've either previously worked with or still working with that then pass on to their friends or family members to get help.
And I want to reiterate and go back to this and make sure people understand exactly the population that you're dealing with every day. We're dealing with young mothers, 18 to 25 years old. We've all been that young before. That's young. Dealing with a mental illness, that's big, homelessness, and the mothers have a child, at least one child, under the age of 5 years old. That's a lot going on. I mean, we're dealing with a lot. And I want to put up, you had talked about some of the services. I want to put up some other services that FACT provides. And if you could speak on these services, I'd appreciate it for our viewers.
Sure. Well, the FACT program it's a comprehensive program that was, we offer clinical services. Our team includes a substance abuse therapist, a parent-child therapist, a senior case manager that specializes in employment, education, and then also a housing resource developer. So with that, we offer the whole gamut of services. We offer clinical services focusing on mom, maybe focusing on domestic violence or her trauma. We offer services for the kids, the parent-child relationship, the therapy services for that. We also offer case management services. So a lot of our moms come in, they haven't graduated from high school or have very limited college experience. So we help them make an employment plan. We help them get a stable income, whether that be getting TANF, which is welfare benefits, or getting disability. Because a lot of our moms, especially the ones that have schizophrenia, bipolar, they realistically aren't going to be able to work in the next few years, if not long term. So we help them so that way they can be self-sufficient. We pretty much offer everything you can imagine in a clinical capacity. We also have a psychiatrist at Beacon that all of our families can meet with. Both the moms and the kids can meet with him.
Wonderful.
And what's wonderful about that is there's no waiting for that. So I know other psychiatrists throughout the community, a participant might have to wait a few months. They can meet with our doctor right away. And then we also have a psychologist who can provide psychological evaluations if we have a concern that maybe a participant has a developmental disability or a personality disorder or something of that nature.
Now we're going to get into your role. We're going to dive further into your role as the child parent therapist. But I want to remind everybody that this is a live call-in show. We are Beacon Therapeutic. We are talking about our FACT services. And I believe we have a caller right now. Good evening. Hello? Might have lost that call, but Kelli, again, you're with the FACT service, the services and the initiative, the Family Assertive Community Treatment, and you are the child parent therapist. And so you're offering a whole host of different services. I want to talk about, just to name a couple, the child parent psychotherapy, the preventing child abuse and neglect, and I know you can go on and on. So let's start with CPP.
Okay. Well, child parent psychotherapy, or short term known as CPP, is an evidence-based clinical model where you offer symbolic play therapy with both the caregiver and the child. And in general, this therapeutic framework is geared for children that are age 6 and younger. It was developed by Alicia Lieberman and Patricia Van Horn, who two are the leaders in infant mental health. And if you are actually interested in learning more about CPP, these are two books that are more or less the framework and the guidebook of what CPP is.
Can you read those titles?
Sure. The first one is Don't Hit My Mommy. And the second one is infant parent psychotherapy. And both these books are available probably off of Amazon or really any bookstore online.
And you've read them?
I've read both of them.
And you highly recommend these for the CPP, again, is child parent psychotherapy.
And Beacon had the great opportunity to be part of an Illinois Learning Collaborative, which was an 18-month intensive training that my supervisor, Kathy Danaher, and myself, as well as other therapists at Beacon, got trained in this model. And we continue to have ongoing consultation calls that still include Patricia Van Horn to get technical assistance on using CPP. And what CPP is it's an idea that, just like any other play therapy, that children speak through play. Their language is play. And we use the symbolic play. So you can think of like dollhouse, toy, dolls, doctor kit, to help these kids who have experienced really scary, awful things cope through that. And what's different about CPP versus other clinical models is that we're not just looking at the child itself. We're looking at that parent and the child relationship.
Yes.
Without a doubt, all of the moms we work with have had some trauma throughout their lives. And so what's great about this model is we look at where mom was at, what mom has gone through, and in CPP you call it the ghosts in the nursery. So maybe
say it again.
Ghosts in the nursery.
Interesting.
And so you look at maybe mom when she was 3 years old, she got physically abused or she got sexually abused and entered foster care, was separated from her parent, and now here she is raising a 3-year-old, and she's scared to death that 3-year-old's going to get abused or something's going to happen at preschool or something like that. And so we look at it in that way, and it helps us to help that mom kind of cope through the trauma she's had when she was a little one, or even as an adult if something happened down the road, and then how that impacts her ability to parent her children. And then the same thing with the kids. We look at the wide range of these traumas our kids have experienced. We have quite a few kids that have witnessed domestic violence between mom and a boyfriend, or sometimes even a mom and a parent or something like that, and help the mom understand how that plays a role in how their child's developed. And
you don't realize how serious it is. I mean, how it's cyclical and how,
Well, and especially when you're looking at kids, because kids don't understand, as an adult, we might see a scary incident, but we know, okay, we're going to be okay and we're going to get through it. But to a kid, if they see a gunshot, or if they might have been separated from their mom without warning for a month.
Can you imagine? I can't imagine.
They don't know. They might think their mom died. They might think that they're never going to see their mom again. And then when they come back and see mom, or when mom's out of that violent relationship and has a new boyfriend, and even if this new boyfriend's a great guy, of course the 2 or the 3-year-old's going to be super scared that guy's going to hurt them again, or that guy's going to hurt their mommy. So that's what's great about CPP is we work with that whole picture. And then with the
speaking of pictures, I want to put up, please keep talking, but this is, these are a couple of our participants, and Kelli and also Kathy Danaher, our project supervisor, is on there as well. And so viewers can put, faces with these people who are suffering from these traumas. Please keep going.
And the great thing about CPP is that it's very flexible, where we can, maybe a mom right now is really needing to work through some of the things she's going through. We can work with mom one-on-one. And what's really great about the FACT team is that we can be flexible where there's other team members to help through this whole process of all of mom's needs.
I mean, you are dealing with a lot, and these people are dealing with a lot, and kudos to you. And again, these are some of our resources with FACT. Again, FACT is the Family Assertive Community Treatment Initiative. And I'm Jenny Brandhorst here with Kelli Hanlon. We're from Beacon Therapeutic. This is a live call-in show. And Kelli, I think you've got some fans tonight because we've got a call. Go ahead, caller.
Hi.
Hi.
I have a question.
Sure.
If a mother is put on any kind of psychiatric drug, how does that affect the relationship between the mother and the child?
That's a good question.
Well, it really depends on what type of psychiatric drug it is. I think the number one is if that mom is not able to be stable, not able to get her needs met without the medication, especially when you're looking at severe diagnoses like bipolar disorder or schizophrenia, where they're manic or psychotic, they can't even care for their kids if they're not on that medication. For families that are women that might have depression and get on antidepressants, sometimes that can play a role in their ability to sort of engage, because sometimes when you're on antidepressants, you might have a harder time engaging with others. But at the same time, without the medications, either maybe they're so depressed that they're staying in bed all day, or they're so psychotic that they can't function day to day, that they're not able to actually take care of their kids. And with our program, we try to work with where the mom's at. If the mom wants to be on medications, we can link her up with that. If she'd rather use talk therapy, we definitely provide that. Or if she wants to use a combination of both. And that's what's really great about our psychiatrist, too, is that he really works with the clients where they want to be.
Mm-hmm. You're on a roll, Kelly. We've got some more calls. Let's go ahead and take another caller. Good evening.
Hi. This sounds like a fantastic program. And I have two questions.
Sure.
Is there a certain amount of time that you can only stay in the program? And if you were to move to another state, are these programs provided in all the states? Or is there just a few in the country? I mean, I don't know.
Well, those are good questions. Kelly, go for it.
There's no time frame of how long a participant can stay in the FACT program. So we really work with where they're at. We help promote them to be self-sufficient. We don't want to make this be a program where they're just dependent on us. But for those that are the hardest to serve, they can stay with us 1, 2, as long as they need to be, 1, 2 years or longer. In terms of other programs that are similar, first of all, there's no similar program in the city of Chicago. We're the only program that targets this young 18 to 25 homeless mothers with mental illness. Throughout the country, this program, the FACT program, was part of a 4-year pilot project through the Strengthening Families and through the National Center for Family Homelessness. So there are a total of 4 other projects throughout the country, 2 in California and 1 in Minnesota. Each project looks a little different. We've targeted that same age range, but the actual services we've provided have been different. But after our funding for this program is actually going to end at the end of June of this year, so just in a little over a month. And
but we want to keep it going.
Yes, we want to keep it going. We
going.
want to keep it going. And at that point, we will really be the only project that's doing this type of work, not just in Chicago, but all around the country.
Yes, and just to echo what you're saying, Kelly, I want to put up some other, just to remind viewers of the population that you're dealing with the FACT program. If you want to go ahead and go through the bullets with our viewers, please.
Sure. Well, so we focus on, again, the 18 to 25 age range, and all the mothers are single mothers too. So these are moms that aren't getting any assistance necessarily, because most of them have very limited support systems. They all have to have a mental health diagnosis that's, like, for example, depression, bipolar disorder, schizophrenia. They have to have a child that's at least 5 years or younger, and they have to be either homeless or at risk of homelessness. And then again, we also look at these additional risk factors like substance abuse, domestic violence, gang involvement, criminal involvement, any issues with their children, medical, developmental, emotional, and then also the DCFS, the child welfare, abuse and neglect involvement. And I think it's also important to note that the vast majority of the families we work with, we're working with the inner city of Chicago, the hardest to serve, with the most limited resources. And you can only imagine what would have led somebody at the age of 18, 19, 20 to be homeless. So these families have experienced significant trauma. We have many families that were sexually abused as kids, physically abused as kids. Over half of our families were in foster care at some point. So these are families that were separated from their parents, didn't get the strongest, most positive pairing as a child. So they're really kind of set up for the worst of a bad situation.
But we've had a lot of successes. Can you talk about that?
Sure. Well, in general, we have had quite a bit of success with once our families have been housed. So we help our families get housed through a subsidized unit through the city of Chicago. Once they have gotten housed, our families, the success of them staying housed, not getting evicted, not getting kicked out, has been really remarkable, especially when you think of the fact these are women, most of them, this is the first time they've ever had their own place. I mean, you think of your traditional college-aged student and the kind of ruckus and trouble they have in an apartment, and these are ladies that are doing okay.
Yeah.
In addition to that, in terms of the child piece, we've seen quite a bit of success in kids that all the kids that we work with get a developmental screening called the Ages and Stages questionnaire when they're part of our program. We do it every 6 months. And we've seen quite a few kids that have had a developmental screen in the concerning range. So maybe they were delayed in speech or gross motor skills, meaning like walking, not walking on time, things like that. And over their time in being a part of FACT, they have shown improvement. We've had 15 kids that have shown improvement over the course of time. In addition to that, to the kids that do get the higher level clinical piece, like the child-parent psychotherapy that we've talked about, what we do with those kids is we do measures to see how their behaviors have been over time. And over 70% of the kids that have gotten child clinical services for 6 months have shown improved decrease in their trauma symptoms,
wow, that's great.
Improved behaviors, and also parent stress. So like how much the parent is actually stressed out about this child has shown improvement too, in over 70% of these families. And then in addition to that, we've seen improved just overall stability. We hadn't had a lot of families that have gotten involved with foster care, and this is a population that's extremely at risk to have DCFS involvement. Not so much for abuse, but for neglect, because these families just really can't provide for their kids. And we've had no families that have had their parental rights terminated. We've had quite a few cases where DCFS became a part of the picture, and then when they learned that the family was working with us, decided not to remove the kids because they thought that we were providing that service to prevent the abuse or the neglect from happening.
And the credibility of the services that we're providing. I mean, there's so many successes, and the impact that FACT has had on the community and the people we're serving is tremendous. Would you agree?
Definitely.
It definitely is an innovative model that needs to be replicated and can be replicated and is very cost effective and cost efficient. And if you want to speak on any of that, please go right ahead.
Well, I think it's important to note that this is the only service in the city of Chicago that offers this level of work for both young mothers, 18 to 25, who have mental illness, and their young children. And without this service, these are a population that just is not going to get served. These are going to be the families that end up being in homeless shelters the rest of their lives or for a very long time, and are going to cost a lot more in the long run.
Yeah. I'm going to put up just a quick little tidbit about Beacon. Again, we're Beacon Therapeutic, and we have been empowering lives and changing futures of many people for quite some time, for more than 43 years. And we are on YouTube and Facebook.
And our website is www.beacon-therapeutic.org. And you can go to both YouTube and Facebook to learn more about the different services at Beacon. We have quite a range of services serving families and children throughout the city of Chicago.
And one last little plug, we also have our Beacon Bash that's coming up Thursday, July 21st, and this is helping our homeless services or homeless outreach services. So you can contact Peggy Rourke at 773-298-6441 for more information on that. And again, Kelly, thank you for being a guest here this evening. And do you have any last minute comments for our viewers?
I guess I just want to again reiterate that this is a program that we really have shown success. There's no other program in the city of Chicago that offers the same level of services, and this is a population that really needs our help. And if not, who knows what's going to happen to them. So it's important that we keep this program running.
Thank you again, Kelly. And thank you for watching us. Again, we're Beacon, and we're on every Tuesday at 4:30. See you next week.